Okay, well, let's see what we have here. Okay, so first of all, you have some sort of technical problems, okay? Um, as I've said, you do not want to have the title or the abstract, the subheadings here, objectives, methods, okay, results, okay, conclusion. That's not the way that we write a summary. Also, you should have a title here. Yes, MS in Oman, right? Multiple sclerosis in Oman. Okay, so but let's read and see if you have all the correct information now. Okay, previous studies have shown that population in the disease clinical features of multiple sclerosis in Oman is low among Asian, Middle Eastern countries. Okay, there's some grammar mistakes here. Previous studies have shown that the population of the disease and its clinical features, multiple sclerosis in Oman is low among Asians and Middle Eastern. Okay, so I'm sorry, I don't understand what you're trying to say here. In Oman, but then is low. So it sounds like you're combining three sentences here, and I'm a little confused. I don't actually know what you're trying to say here. There's also no studies about the clinical features of MS in Oman. Okay. That's a good segue, I think. The next, okay, you don't need this method. And the aim is not part of the method, it's part of the introduction, actually. The aim of this research is to document clinical characteristics of MS seen in Oman and to compare to those seen in the Arab population. That's not actually what their aim says. Compare with other studies, that's what it says. Asian and Western world. Okay, so that's a little confusing there. Seen in the Arab, Asian, and Western world. Okay, that's fine. The research included 30 Omani patients. There were male and female. Okay, so instead of just saying male and female, you should put the number here as well. From different ages between... Okay, you can't have a bracket here. Okay, you need to exclude the bracket. Between 19 and 42 years old. Okay, that's fine. The study have made an SQU. Okay, look at the grammar on page 150. Okay, have made. Really? I think you have the wrong tense here. In SQU hospital and carried out in 10-year period. Okay, it might be better to say from 2000 to or was it 1990 to 2000? That's as opposed to saying 10-year period, because this 10-year period could be any time. It is concluded that all patients were seen and followed up by doctors. That was conducted, okay? That's fine. That's how they collected the information. That's good. The data was collected through neurological evaluation and detailed regarding placing residence and family history. Okay, that's fine. I think you have most of the information there. Who, where, when. Remember, we don't know necessarily what SQU is, SQU hospital is, so you might need to say that in full. Research was evident that the ratio of MS to motor neurological disease was 1.17. Okay, is this part of the clinical features that we talked about in the aim? If not, we don't need it. Okay, the male to female ratio was okay. Again, this is something that we could use, but you didn't really mention the total number of males and females, okay? Here you're listing it, but you might have wanted to list that in your methods and material. The longest duration of the illness was 15 years. Again, is that a clinical feature? Do we need to say that? I'm not sure if we do. The shortest 2 months at a time diagnosis 12 patients presented with blurry vision. Okay. I think you're including information that you don't really need and then excluding information that you do need. So the blurry vision is good, but there were some other facts that we want to talk about, and you didn't include the numbers to support this. Okay? So the conclusion, evidence may prove that there is no family factors is an unexpected factor, that they may appear. Okay? I'm not sure what you're saying here. Therefore, future studies need to focus on the community-based incidence and prevalence. Okay, that's fine. Okay, so these are all recommendations and conclusions. That's fine, but you've missed the aim. You haven't actually talked about the clinical features. Yeah, so this is a problem. Yeah, we need to talk about what clinical features did they find to be most prevalent in Oman, and I'm afraid that you missed that. You missed the main part of the writing. So if you want to rewrite this, you can, and I'll give you more feedback. That's it.